Drugs. A job seeker's nightmare in Zimbabwe. In a country where economic hardships and high unemployment rates are a daily reality, the youth of Zimbabwe are facing an escalating crisis: drug and substance abuse. What starts as a coping mechanism for stress and idleness quickly becomes a significant roadblock to employment, turning a difficult job market into an almost impossible one for those caught in its grip. The vicious cycle. From unemployment to addiction. Many young Zimbabweans, particularly recent graduates, find themselves in a distressing cycle. The lack of jobs and financial instability leads to a sense of hopelessness, and for some, illicit drugs become an escape from the harsh reality. The ready availability of cheap substances like bronco, musambodia, and crystal methamphetamine, mutoriro, makes it easy for them to fall into addiction. This behavior, however, has severe consequences that directly impact their ability to find and keep a job. Drug use often leads to impaired cognitive function. Regular drug use, especially of substances like marijuana, can impair short-term memory, critical thinking, and learning skills, all essential for job performance. Physical and mental health issues. Addiction is linked to a range of health problems and psychological distress, including depression and anxiety. These conditions can make it difficult for an individual to maintain a consistent work schedule or focus on tasks. Antisocial behavior. Drug abuse can lead to violent behavior, disrespect for authority, and other antisocial traits, which are immediate red flags for any potential employer. The employer's perspective. Employers in Zimbabwe are increasingly aware of the societal impact of drug abuse. To mitigate risks and ensure a safe and productive workplace, many are implementing pre-employment drug testing as a standard part of their hiring process. While not yet a widespread legal requirement, some companies, particularly in industries involving heavy machinery, transport, or sensitive roles, are now screening candidates for substances. A positive drug test result can be an immediate disqualification for a candidate, regardless of their qualifications or skills. Companies are justified in this approach as it helps protect their brand reputation, reduces the risk of accidents and injuries, and promotes a safer work environment for all employees. Navigating the road to recovery and employment. For a job seeker with a history of drug abuse, the path to employment is challenging but not impossible. The first and most critical step is rehabilitation. Fortunately, a number of institutions in Zimbabwe, such as Highlands Halfway House and St. Giles Medical Rehabilitation Center, offer services for those struggling with addiction. These facilities provide professional support, including therapy and life skills training, to help individuals reclaim their well-being. Once on the path to recovery, a job seeker should be honest and transparent. During the interview process, it's often wise to address a gap in your resume or a past issue with transparency, focusing on the steps you've taken toward recovery and your commitment to a drug-free life. Focus on skills and experience. Highlight your skills, educational qualifications, and any relevant work experience. Showcase how you've used your time to improve yourself and prepare for the workforce. Seek support. Organizations like SAYWHAT, Students and Youth Working on HIV, AIDS, and Mubadirapamwe offer counseling and support programs that can assist with re-entry into society and the job market. They can help with interview preparation, resume building, and finding opportunities. The drug crisis in Zimbabwe is a complex issue deeply intertwined with socioeconomic problems. However, for job seekers, overcoming addiction is the first and most crucial step toward securing a better future. It requires courage, professional help, and a firm commitment to building a new, drug-free life. The government of Zimbabwe and various civil society organizations are undertaking a multi-pronged approach to combat the rising tide of drug and substance abuse. Their efforts, while facing significant challenges, are focused on both a supply reduction and a demand reduction strategy. Government initiatives. The government has declared drug and substance abuse a national disaster, and has taken several key steps to address the crisis. Policy and legal frameworks. The government has developed and is working to implement the Zimbabwe Multi-Sectoral Drug and Substance Abuse Plan, 2024-2030. Point 2. This comprehensive plan is a significant shift from a purely legalistic approach to one that incorporates public health and human-centered principles. The plan is organized around 5 main pillars. Supply reduction. This involves strengthening law enforcement efforts to disrupt drug trafficking and supply chains. The government has arrested numerous drug suppliers and end users and has destroyed illegal drug trading bases. Demand reduction. This pillar focuses on prevention, public awareness, and education campaigns, particularly targeting the youth. Harm reduction. The plan acknowledges the need for harm reduction services, though implementation in this area has been slow. Treatment and rehabilitation. The government aims to establish and expand outpatient psychosocial support centers and procure psychotropic medicines for rehabilitation. Community reintegration. Efforts are being made to support the reintegration of individuals back into society after rehabilitation. Institutional frameworks. An interministerial committee has been established, led by the Ministry of Defense, to coordinate the government's response. Furthermore, the cabinet has approved the principles for the Zimbabwe Drug and Substance Agency Bill, which would create a specialized agency responsible for the enforcement of drug laws and the coordination of anti-drug efforts. Socioeconomic interventions. Recognizing the link between unemployment and drug abuse, the government has made cheap loans available to young people to help them start income-generating projects. Civil society and NGO efforts. Civil society organizations, CSOs, are playing a crucial role, often filling in the gaps where government resources are limited. Their work is characterized by advocacy, research, and direct community interventions. Advocacy and policy reform. Organizations like the Zimbabwe Civil Liberties and Drug Network, ZCLDN, are at the forefront of advocating for more humane and evidence-based drug policies. They have been instrumental in influencing the development of the National Drug Master Plan and are pushing for the decriminalization of drug use, arguing that it is a public health issue rather than a criminal one. Research and data collection. CSOs, often in partnership with international organizations like UNICEF, are conducting research to understand the magnitude and dynamics of the drug crisis. This data is vital for informing policy and developing effective interventions. Community-based interventions. Communities Against Drug and Substance Abuse, CADASA, Trust focuses on prevention and awareness programs in schools and households, providing counseling and support to children and families. Youth Advocates Zimbabwe, YAZ, operates a helpline to link young people in crisis to critical services. Other organizations run outreach programs, peer-led initiatives, and support groups to provide information, counseling, and harm reduction services to people who use drugs. Harm reduction. While government efforts in this area are still developing, CSOs are leading the charge. They are advocating for services such as needle and syringe programs to prevent the spread of infectious diseases like HIV, and naloxone interventions to combat overdose. In summary, the fight against drugs in Zimbabwe is a collaborative effort. While the government is taking significant legislative and institutional steps, civil society organizations are providing essential on-the-ground support, advocacy, and research to ensure the response is both effective and human-centered. However, challenges remain, including limited resources, gaps in legislation, and a persistent social stigma that can hinder individuals from seeking help.